So while the Public Health Agency of Canada has updated its COVID-19 recommendations, we asked you to send in your coronavirus questions. So joining us this morning with some answers is infectious disease specialist Dr. Isaac Bogash. Good to have you back with us.
Oh, great to see you.
So one Instagram user wants to know this. Canada's top doctor, talking about Teresa Tam, recommending wearing 3-layer masks with a filter for maximum protection while indoors. Why?
That's a great question. And certainly that's just the evolution of our policies. The first step was, hey, let's all put on some masks when we go indoors. And now it's let's make sure the caliber of those masks are up here instead of down here. This is just better able to filter or trap viruses that might be coming out of people's mouths and nose. Just makes the environment around everybody safer.
Yeah, a lot of people have ordered masks online or got them from stores, and there's usually like a little pocket in between, and you can slip the filter in there. Some people don't know how to look for that.
Yeah, exactly. And in fact, they have pretty clear directions and instructions on how to make one and what to look for if you're purchasing one. And I think we should also point out that the masks that most people have right now are probably going to be just fine. Like, there's no reason to panic and run out and get this exact same mask. Like, you're going to be okay, and you've got a lot of wiggle room. This is just a pivot in what we should be wearing, and you've got plenty of time to go and pick one of these up. They're everywhere.
All right, so we're going to take this question a little bit global. Countries like Ireland have gone into a national lockdown for 6 weeks with the goal of preserving the holidays. Is that something that we should be looking at here, looking ahead to the Christmas season?
Yeah, it's a good point. There's lots of different strategies to how to manage this epidemic locally and nationally. I don't think that's going to be a very likely scenario here. If we look at the various provinces' approach and we look at how soon Christmas, New Year's, Hanukkah, Diwali is to where we are right now, just to be completely transparent, it doesn't look like we're going to be able to, see a sustained rapid reduction in the number of new cases. So I think we can expect a very modified holiday season this year.
This next question comes from a member of Your Morning team. A person in Alberta has been diagnosed with a rare form of the flu. Now, according to Alberta's Chief Medical Officer of Health, Dina Hinshaw, only 27 cases of the virus have been confirmed worldwide. What is this, and should people be worried?
Yeah, so this is what's called an H1N2 variant of the flu. And all we can think right now is like, come on, not now. We don't need this now. We're in the middle of the COVID-19 pandemic. We don't need a new pathogen circulating. So far, with the very limited data we have to date, it appears that, first of all, that person is doing okay that had this infection. The second thing is it likely came from a pig or a farm animal, probably a pig. And the third thing is, at the moment, I've got to be very careful with my words, but at the moment, it doesn't appear like this poses a significant risk. But of course, it requires further evaluation.
This next question we've had before, but it bears repeating because, as you always point out, the virus can change and mutate. We're learning more things all the time. Should I not let people pet my dog?
This is interesting. And in general, the knee-jerk action to that is no. We're not shaking people's hands or giving anyone a high five, so we shouldn't be letting people pet their dog. Having said that, I think our understanding of the virus and how it's transmitted has changed significantly since March and April of this year. We know it's extremely unlikely for people to get this infection by touching something and then touching their eyes, nose, or mouth. Of course, hand hygiene is still extremely important, and we should be practicing hand hygiene. But in general, we shouldn't be petting other people's dogs. And if you are, okay, wash your hands right after.
All right, this next one comes from Instagram. They want to know, if you quarantine for 14 days, is it safe to stay at your parents' house?
You've got to be careful with that. If you can truly quarantine for 14 days and you can truly separate yourself from the world around you for that period of time, yeah, you'd be okay. The answer is, though, it's very difficult to actually do that. And I think we have more interactions with others than we care to believe or care to admit. But if you can really quarantine yourself and you don't have any interaction with other people for 14 days and you're really isolated in your home or apartment, yeah, you should be safe to go visit your parents or loved one.
Dr. Bogash, I know you're extremely busy because I see you on television at all times of the day. Plus, you're still practicing. Thanks, as always, for taking time to answer our questions.
My pleasure. Have a great day.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.